The way my bit of public health is organised at the moment, you have 7 health boards in Wales, and then there are still 3 trusts left over. You'll have heard of the Ambulance Trust, you'll have heard of the very special Velindre Hospital, which is a little trust, and then Public Health Wales, which acts to support public health across Wales. But that's not the only bit of public health, because the health boards have the key player really in the public health system, the Director of Public Health. And for these 3 counties within Hywel University Health Board, that's Teresa Owen. But also the Minister is part of the public health system, the Welsh Government is. But more fundamentally than that, local authority colleagues who make sure that your water is clean or that your food is safe. More importantly than that, who looks after themselves. It's us, isn't it? It's the public. But in terms of public health, my bit of the system, we're concerned with things like outbreaks. And you know we've been concerned about measles and TB and things like that, and flu, whichever goes round. Immunisation against many of those things. We're concerned about screening, the programmes we run to try and help you avoid serious illness down the track, so breast screening, cervical screening, the new bowel screening programme where we need to start talking in ordinary conversation about putting bits of our poo on bits of cardboard and keeping it on the shelf for 10 days and then sending it back. That's an odd sort of conversation which we need to start talking about, which is how the bowel screening programme works. Ask me about it over coffee if you fancy. We're very concerned with data and information because there's power in information. How much cancer services does each health board need? How many old people are we going to have in 20 years' time? And the Minister referenced some of the report work we're doing there. But most fundamentally, and my passion, is health promotion. How can we just not need anything at all? In general, the only bit of the health service we'd like to exist is maternity. Well women coming in to have well babies. The rest of it we wish didn't exist at all. Remember when the NHS was set up in the late 40s, they thought that they'd have a massive rush for 9 months and then it'd be very quiet. Health promotion, helping ourselves to be illness and disease-free. And the partnership working it takes to do that. And that's why it's a joy to be part of this today, because there's a partnership conversation. And to see people I've known for years in different settings, all in the same room at the same time, is quite vibrant, actually. It's quite an interesting combination of people today. I'm really looking forward to the passionate discussion we're going to have. Well, you can't see it, it doesn't really matter, but I twisted my talk around from what it said on the programme to calling it financial security and health. It seemed a bit more fundamental. And I want to pick up on the word health to start with, and I'm a little bit fed up, actually, because we use the word health to mean the National Health Service. It isn't at all, is it? They've stolen our word, actually, to set up the NHS, because the NHS is mostly about when there's something not quite right, and they'll help us sort it out. Health belongs to us. Health belongs to local authorities, voluntary sector organisations, but us as communities, us as individuals. And we're talking really a little bit, I'm going to give you a little bit of how I feel about the link between financial security and health. So I'm just going to throw in, I was listening carefully to the conversation we've had so far, wondering what would already be covered in the talk so far. And so I'm just going to throw in a few more bits of the jigsaw which might help us in our discussion and help us in our arguments when we're trying to take these ideas forward after today. Let's find a button that works. Oh, there's a mouse there. Oh, there we are. Right. It doesn't matter at all if you can't see any. They're just some pretty pictures to amuse you in the background. But actually, I want the wrong one. That's the one I wanted. Hat. Hat are you worrying? Hat are you worrying about? What are you worrying about today? It starts with ourselves, doesn't it? How are you today? What are you worrying about today? In the midst of this, I'm going to work today, I'm going to a meeting today, I'm going to a conference today, but actually I'm wondering what's going to come in the post today. I'm wondering how my children are getting on in school today. I'm wondering how my elderly relative is today. I'm wondering how I'm going to get on. And that's where it starts from, doesn't it? And everything we construct around it is to support that. Why do we have health services organised? Because we need a bit of organisation around it. But it's just to help us live our lives. And really everything we discuss starts from that microcosm. I was thinking about, Ian, why haven't you joined the credit union? And it's in the same bag for me as, why don't I go and give blood? Why don't I brush my teeth properly? Why don't I make sure that I go to the dentist every 6 months? We are people that are slow to make decisions and slow to do things about the things that we actually care about. And some of our discussions today is get a bit more passion back into that and find those levers and arguments that will help us and help other people to go on the journey that we want to talk about today. But you're full of journeys, aren't you? You've got 20 things actually you'd like people to think about. And you've probably got 52 things that you'd like to do about yourself. So it starts from us as individuals. I had a sneak preview of Leslie's report, and one of the diagrams I was pleased to see that she's put in there is reference to some work by a lady called, I've forgotten her name, Lynn Friedley, who's done a lot of work about the link between mental health and financial security. And she talks about things like the importance of the environment to people's mental health. She's talking about general security, general mental health, and the effects, what affects that. And she talks about food, but she talks about civil security, and within that she talks about things like education and financial security. No surprises there, really. The things that make us feel good, empower us, grow us as individuals. There's a whole mass of things that play into that. And she's particularly exploring mental health, which we've referenced already, emotional health, psychological health, physical health. They're all bound up together. And another perhaps familiar picture to you, when Maslow did his work back in the 1940s about what are the fundamentals of life, I thought it was useful to throw that up again and remind us of how he constructed the things that affect people's lives. He talks about motivational needs. And the idea with his work is that there are things that affect us, and if we haven't sorted out the things at the bottom of the pyramid, there's no chance of sorting out the things further up the pyramid. And so what the fundamentals at the bottom are things like food and shelter. So you can forget everything else unless those are sorted out. But further up then, quite surprisingly further up, esteem, self-esteem. Well, if we're saying, gosh, isn't that fundamental? And Maslow's saying there's a shed load of things to get secure before you can really secure self-esteem, then there's a long journey to go through. It doesn't matter. These are familiar things to you, or if you're interested, you'll go and find out for yourself afterwards as you construct your arguments. But perhaps something from a public health perspective that you may not have looked at so much, which is of great interest to us, is the divide between the rich and the poor, and the effects that this has on people's health and well-being. Not just the fact that people who are struggling are far more likely to get certain diseases and conditions, far more likely to be struggling to fulfill their potential in terms of education and psychological well-being, but the fact that the divide between people that are hard-pressed and people that are well-off makes a difference. We use terms like inequalities or inequities to try and drive our work, and it's really, really hard. If I every day say to myself, today I'm going to make a difference to inequalities, and I try and do something about that, whether it's through the sort of programs that we run or through the advice that we give to others that run services, it's really, really hard, isn't it? Every time I think of a new service that might particularly help those that are hard-pressed, I fall into the usual traps of using the written word to advertise it, assuming that everybody has got as much literacy as I have. Or putting the posters up in the usual places like the doctor's waiting room. Well, who actually walks across the doctor's waiting room and leans over the person that's coughing on the bench there to look at an advert on the notice board there? Who actually thinks that something that I have created is for them? That someone like me, who is hard-pressed, could actually use a service like that. You know, the idea that leisure centres are built for people to come and become more active. Well, you have to be thin enough to go in, don't you? And you have to have a pink leotard, and you have to have transport, and you have to have somebody to look after the children while you go there. You know, we trip over ourselves all the time as we try and do that. But this idea that it's not just the fact that we have people that are hard-pressed, but the divide itself makes a difference. There's a graph, okay, I'll tell you all about it, but it tells you something, and if you want to know more, ask me afterwards. This idea that if you look at countries that have a divide between the rich and the poor, it makes a difference to the overall success of that country. This graph shows you there's a number of countries been looked at there, and they've looked at things like literacy, infant mortality, prison populations, teenage births, obesity, mental illness. And the wider the gap between the rich and the poor, the more of those things they have. So it's in our interest as a nation to try and narrow that gap in any way we can, because as a nation we will all benefit from less people getting involved in things that ends up in prison. Less of our young people have unintended teenage pregnancy. Less people being obese, somehow, surprisingly. Better literacy, better life expectancy. So, you know, successful countries that are on there like Australia and Italy and Portugal, right at the far end. Successful, yes, but a huge gap and more of those problems. Down this end, Japan. Very successful country. This is just a snapshot of fairly successful countries. But you can look at some poorer countries, poorer, whatever that means, with a narrower gap, and somehow they have less of those things going on. Just an interesting, perhaps, an argument to add to your toolbox when you're talking to decision makers about why should we be discussing what we're discussing. Another pretty picture. This is my Bible in health promotion. Back in 1986, we had a meeting. They had a meeting. I wasn't there. Pretend I was. In Ottawa, in Canada, and they created a charter for how health promotion works, and it's called, surprisingly, the Ottawa Charter. And it talks about what we should all be doing to make changes so that people don't have to use health services, or people don't have to go to local authorities for extra help. And it talks about enabling, it talks about advocating, it talks about mediating, the things perhaps that I do all day, every day in my work, and many of you do as well, either in your work or in your voluntary capacity with the passion that you bring to some of the arguments we're having today. And it talks about 5 ways that I go about my work, and they're not surprising too. It talks about policy, changing things like the smoking ban. We're not smoking in here today. We decided that's not appropriate. Or we wear seatbelts, or we wear hard hats on building sites, or could we actually put a minimum price on a unit of alcohol? Or could we put fluoride in the water, please? Because that would make a big difference. Policy like that, laws, school rules, uniform, why do we have uniforms in schools? School meals policy, can we stop spending only about 2p on a meal? Can we do something about school meals? Policy in all its form, fundamental in my work. Supportive environments, making it easy for people to make healthier choices. So having support services for people that want to give up smoking, or counselling services, or treatment services or for things like alcohol misuse and so on. And turning the NHS over is one of the fundamentals that they decided in Ottawa in 1986 we should be doing, that the health service should actually be a health service. Peter articulated it. We're just consumed with, oh, we've got enough cancer services, are we going to have heart attack services, are we going to have stroke services, all these things are so important. There's hardly a moment for our health boards to lift their heads and think, oh, how can we shut this off at the source? We're seeing lung cancer rates in men starting to fall now, 30 years after the smoking rates in men started to fall. That's a long lead-in time. That's really hard for health boards, for councils to get a grip with, when actually, you know, the minister will want to know by next March, what have you done, not March 30 years' time. Interestingly, I'm sorry, that to say that the lung cancer rate in women is still going up, because 30 years ago women were still taking up smoking and still increasing. It's long lead-in time, so it's really tough, I think, and I think we need to be realistic about what our health boards are for, what our local authorities are for, and in the midst of financial crises, we talk about this, you know, for example, the arts. Should local authorities fund the arts? Well, yes, of course they should. It's fundamental to self-esteem and emotional well-being and so on. But when they're hard-pressed, getting them to lift their heads and think that's as important as making sure that the schools are running and the bins are collected and so on is really tough. And we need to be part of that discussion. The other two things on my Ottawa Charter there about helping people with personal skills. How can I change my life? How can I turn all the messages I've got up here into action? You know, like, for example, I have 3 daughters. I only ever told them once to keep their bedrooms tidy. You believe that, don't you? There's so much stuff in our heads. How do we turn it into action? You've probably got 50 things in your head. You know, if I said, what have you done in the last week that you probably think was not good for your health, we'd probably have a race to fill the page, wouldn't we, really? Because we know stuff and we don't do stuff. Why haven't I joined the credit union? Why haven't I given blood regularly? Why only finally at my age do I brush my teeth for 2 minutes at a time, because I finally bought an expensive toothbrush that tells me when 2 minutes is up? So personal skills for that. And you know, in the main, we are clever people in this room. We're empowered people in this room. We're sensible people in this room. And we want to support people that find it tough to make changes and make decisions. But the one that you can see that there's a little squiggle that breaks out of the circle in the little picture they made in Ottawa, and that's community action. Strengthening community action. Things people want to do for themselves are the most powerful. The things that communities want to do for themselves are the most powerful. And when you have an individual idea and you try and find people around you to work with you, if they have the same passion as you, you will change the world, won't you? Most voluntary organisations start because nobody else would do it. You know, whether it was my child was born with a strange condition and I couldn't get any help, and I reached out and found some other people and we formed our own voluntary group. Or I saw a need in my community and I tried to find some people, and we get a passion around it. And this is what's happening in this room. And we want to transfer our passion to others who have competing passions. Even within, we mentioned our GP community. Every GP is a different passion. Finding those that want to talk to us about this or this or this. It's about finding those people and harnessing those passions. I get frustrated by the relationship between the state, the NHS, local authorities, and voluntary organisations. The state seems to loom over the voluntary organisations. Take our hospice movement. We're really glad they're there. But somehow we expect them to behave like the state behaves. Well, no, you didn't get organised, we got organised. And this is how we got organised. To help us organise like we want to be organised. And if you give us £10, don't make us follow all the rules that you have to follow, because we get £100,000 through our charity shop. Well, we do, don't we? Because in the state sector, we have to tell the minister, we have to tell the boss, we have to follow our rules, and these are the forms you have to fill in if you're going to get £10 from us. But community action really is about partnership working. And another fairly sexy term these days, co-production. I thought I'd throw up there as well, just in case it helps us win any arguments when we're talking to people who think it's an important term to use. Partnerships. Partnerships is about giving away power, isn't it? Partnerships is sharing a vision and being prepared to get involved at our own expense and working together. Co-production enables citizens and professionals to share power and work together in equal partnership to create opportunities for people to access support when they need it and to contribute to social change. So that's what we're up to here today, aren't we? We're going to try and find ways, arguments, levers, passions. What's in it for you? What will help you if I do this? And can you help us? Well, yes, fundamentally, credit unions will support financial security. Financial security is fundamental to my health and well-being, to your health and well-being. It is in the interest of the health boards, of local councils, but it's hard for them to think like that, so we've got to help them somehow. So whether it's just because they're big employers, let's try that lever. Or because the minister stood here today and said so, let's use that lever. Or, find the levers that will work so that we give away, they give away, we work together in partnership. You can't see our members of Lance are bridging a gap there by working together. And it seemed to me that there's weak people being supported in the middle of the chain there, and there's strong people that are supporting. And maybe tomorrow the strong person will be weak and the weak person will be strong. But there's shared ownership, there's shared passion. So good luck to us in finding those levers and sharing that passion and seeing what we can do in our work, in our communities, in our action. I'm looking forward to it. So thank you very much indeed.